Every single day, seniors over 60 clear their throat an average of 47 times. Not occasionally, not during allergy season, every single day. And the majority of those seniors have been managing this problem for months or years without a single doctor properly explaining what is actually causing it. That explanation is what the next 20 minutes are about. My name is Dr. James Carter. For over 2 decades, I have worked exclusively with senior patients. And persistent throat mucus comes up more frequently than almost any other quality of life complaint I hear. Every time, the same story. Dismissed as aging, given lozenges, told to drink more water, and the actual cause never addressed. Subscribe right now and hit the bell. Every week, I publish health information your last 3 appointments never covered. Hit the like button and type in the comments right now, is your throat mucus worse first thing in the morning, or does it persist all day? Type morning or all day, because that one answer tells me a great deal about which of the 5 causes is driving your specific situation. Now, one piece of biology before the causes, because without it, nothing else makes complete sense. Your body produces mucus every single day around the clock. That is completely normal and completely necessary. Mucus is your respiratory system's protective coating, capturing bacteria, dust, and viral particles before they reach your lungs. The problem after 60 is not the mucus. Your airways are lined with millions of microscopic hair-like structures called cilia. Their job is to sweep mucus continuously upward and outward, keeping it thin, moving, and never accumulating. In a younger adult, this works efficiently. But peer-reviewed research confirms that after 60, these cilia beat significantly less frequently. Mucus they cleared in seconds at age 40 can pool for hours at age 70. This is called mucociliary clearance decline, and it means any factor pushing your body toward excess mucus production hits harder and lasts longer in a senior than in anyone younger. Before the 5 causes, a patient whose case made this topic impossible to ignore. A senior came to see me several years ago. 71 years old, had been clearing their throat constantly for nearly 3 years. Tried antihistamines, steam inhalation, dairy elimination, every pharmacy remedy available. 3 specific questions revealed that 3 of the 5 causes were operating simultaneously. And the antihistamine being taken for months was making one of those causes measurably worse. 6 weeks after addressing all 3 underlying mechanisms, constant throat clearing reduced by more than 70%. Not because anything dramatic changed, because the actual causes were finally identified and addressed. Now, the 5 causes. Cause 1, laryngopharyngeal reflux. Silent reflux, the most frequently missed explanation for persistent throat mucus in seniors over 60. Most people know heartburn, that burning chest sensation after a heavy meal. But there is a quieter and far more deceptive version, one with no chest burning, no digestive discomfort, no clue pointing toward the stomach, just a throat that will not settle, and mucus worst in the first hour after waking. Here is what happens. At the junction between your esophagus and stomach, there is a muscular valve whose only job is to stay closed after eating. As we age, this valve gradually loses tone, like a rubber band stretched too many times. When it fails to close completely, stomach acid travels upward, all the way to the throat and voice box. The tissues of your throat are not built to handle acid. Even the smallest trace triggers an immediate protective response. Your body rushes to produce thick mucus to coat and protect the irritated tissue. Completely logical biology. But when this happens every night while you sleep, you wake every morning to that familiar heaviness with absolutely no idea why. Because there is no heartburn, no chest pain, no signal pointing toward your stomach. Research published in clinical ENT literature shows that up to 50% of people with silent reflux report no heartburn at all. Just chronic throat clearing, a rough morning voice, and mucus that accumulates from the moment they wake. Ask yourself 3 questions right now. Is your throat significantly worse in the morning than later in the day? Does clearing worsen when you bend forward or lie down? Has your voice sounded rougher when you first wake up? 2 or 3 yes answers. Silent reflux deserves serious attention at your next appointment. One critical warning. If you regularly take ibuprofen or naproxen for joint pain, research confirms this class of medications reduces the stomach lining's natural protection, making silent reflux significantly more likely to occur and harder to control. If you take these regularly and your throat has been persistently bothered, bring that specific connection to your doctor. Type yes morning or no in the comments right now and tell me whether you take ibuprofen or naproxen regularly, because that combination is one of the most consistently missed driver combinations in senior throat health. Cause 2. Chronic silent sinus inflammation with postnasal drip. When most people think of sinus problems, they imagine the dramatic version: intense facial pressure, throbbing headache, nose completely blocked. But in many seniors, the inflammation is invisible. Breathing feels fine, no headache, and yet the sinuses, mildly swollen and producing slightly more mucus than normal, are draining steadily and silently down the back of the throat all day. A 2024 study confirmed the average age of presentation is exactly 55, making this specifically a senior health issue. Here is why antihistamines disappoint most seniors. They dry mucus temporarily but do nothing for the underlying sinus inflammation causing excess production. And dried, thickened mucus at the back of the throat is frequently more uncomfortable than the original symptom. The approach with the most consistent research support is nasal irrigation, regular rinsing with warm saline that physically removes inflammatory mucus, reduces mucosal swelling, and improves cilia clearance function. A 2025 clinical review in the journal Medicina concluded nasal irrigation is an effective, safe, low-cost strategy endorsed by ENT specialists internationally. The single most important word: consistency. Daily practice produces cumulative improvement. 1 or 2 uses produces 1 or 2 days of mild relief. The specific protocol is in the morning routine section at the end of this video. Cause 3. ACE inhibitor medication side effect. This is the cause that produces the most visible surprise in senior patients. A class of blood pressure medications called ACE inhibitors, angiotensin-converting enzyme inhibitors, are prescribed tens of millions of times every year. Effective, well tolerated in most respects. But they carry a recognized class-wide side effect. They allow a substance called bradykinin to accumulate in the body. And in between 5 and 20% of users, that accumulation triggers persistent throat irritation and a continuous urge to clear the throat. Here is why this connection is so consistently missed. The side effect can take weeks or months to develop after starting the medication. If you began a blood pressure pill 8 months ago and your throat started bothering you 6 months ago, you may never have connected those 2 events. But that exact timing pattern is precisely what the research describes. A large-scale study of over 27,000 patients found adults over 65 had a 53% higher risk of experiencing this throat side effect compared to younger users. If you take a blood pressure medication and are unsure whether it belongs to this class, your pharmacist can confirm in under 1 minute. And if it does, alternative medications called ARBs achieve identical blood pressure control without this specific side effect. That conversation with your physician is worth having. I want to pause here for 1 moment. Think about when your throat mucus problem started. Give it a specific time frame. Now think about whether you started or changed any medication within the 6 months before that. Type checking in the comments right now if you are doing that mental calculation, because that 6-month window between a new medication and a new symptom is the most consistently overlooked diagnostic connection in senior throat health. Identifying it could resolve your problem with a single conversation. Cause 4. Chronic mild dehydration. Not simply a reminder to drink more water, a specific aging-related mechanism that makes dehydration uniquely damaging for throat mucus in seniors. Your mucus is mostly water. Its consistency, whether thin and fluid and easily cleared, or thick and sticky and impossible to move, is directly determined by tissue hydration. Think of maple syrup fresh from the bottle versus maple syrup sitting open overnight. Same substance, completely different behavior. Your mucus works identically based on hydration state. The aging-specific problem. Research has clearly established that the thirst mechanism becomes significantly less reliable after 60. A younger adult feels thirsty well before meaningful dehydration occurs. In seniors, that early warning system is blunted. You can be dehydrated enough to noticeably affect mucus consistency without feeling thirsty at all. Waiting for thirst means operating consistently behind the curve. And mild chronic dehydration maintained day after day keeps mucus persistently thick, amplifying every other cause on this list simultaneously. Clinical nutrition guidance recommends approximately 30 milliliters per kilogram of body weight per day from all sources. But the behavioral key is deliberate, consistent intake throughout the day, not catching up when you eventually feel thirsty. Cause 5. Gut microbiome disruption and the gut-lung axis. This is the cause that receives the least attention and represents the biggest gap in standard senior throat health discussions. Your digestive tract and respiratory system share regulatory pathways through both the immune system and the nervous system. The health of your gut microbiome, the trillions of bacteria in your intestines, directly influences how reactive and inflamed your upper airways are. When the gut microbiome is disrupted, a state called dysbiosis that activates immune responses that promote mucus overproduction in the airways. Not because anything is physically wrong with your throat, because the gut is sending inflammatory signals that your respiratory system responds to. This connection, the gut-lung axis, is an active area of peer-reviewed research. Studies published in the American Journal of Respiratory and Critical Care Medicine and the Journal of Allergy and Clinical Immunology confirmed that gut microbiome disruption triggers immune responses promoting airway inflammation. Animal model research demonstrated a direct causal link. Mice receiving gut microbiome transplants from patients with chronic lung disease showed measurably increased airway mucus production. What disrupts the gut microbiome in seniors? Low-fiber diet, repeated antibiotic courses over the years, high sugar intake, chronic stress. These are not exotic factors. They describe the daily reality of most seniors over 60. You will not fix a gut-lung axis problem with a throat lozenge or antihistamine, but you can begin supporting your gut microbiome through consistent daily choices. And I will give you exactly how in the morning protocol. Before the protocol, an urgent warning I must say clearly. The vast majority of persistent throat mucus in seniors is exactly what we have discussed: benign, addressable, not dangerous. But contact your doctor promptly if you notice any of the following alongside throat mucus. Mucus consistently tinged with blood, even in small amounts. Difficulty swallowing that is gradually worsening. Unexplained weight loss, a lump or swelling in the neck. Significant voice change that is not improving. These signs go beyond today's conversation. Please do not work around them. Now, the complete morning protocol. 6 specific steps. Step 1. Stop eating at least 3 hours before lying down. 3 hours of upright time after your last meal is one of the most evidence-supported behavioral changes for reducing nighttime silent reflux. Step 2. Elevate the head of your bed with a firm wedge under the headboard, not extra pillows under your head, which simply bends your neck. Even a few centimeters uses gravity to reduce acid traveling toward your throat during sleep. Step 3. 2 full glasses of warm water within the first 20 minutes of waking. Before coffee, before anything, immediately begins rehydrating, loosening overnight mucus accumulation, and supporting cilia clearance function. Step 4. Daily nasal irrigation using a neti pot or pharmacy squeeze bottle. Boiled water cooled to comfortable warmth. Never tap water directly. Small pinch of plain salt. Optionally, a small pinch of bicarbonate of soda to gently neutralize nasal acidity. Once daily, preferably morning. 2 full consistent weeks before evaluating results. Step 5. 1 daily serving of fermented food to support the gut-lung axis. Plain yogurt with live active cultures, kefir, kimchi, sauerkraut. Long-term strategy, not an overnight fix, but long-term strategies are the ones that actually change your baseline. Step 6. Review your medication list with your doctor, specifically in context of your throat symptoms. Bring a written timeline, when symptoms started, when you last changed or started a medication. Ask directly whether any blood pressure medication you take is an ACE inhibitor and whether an ARB alternative might be appropriate. Quick words on home remedies. Honey, genuinely soothing for irritated throat tissue. Temporarily calming. Does not address any of the 5 causes. Symptom management only. Dairy avoidance. Science does not support that dairy creates mucus, but some individuals notice a sensation of increased thickness. A 2 to 3 week personal trial is worthwhile if you notice a consistent pattern. Apple cider vinegar for anyone with silent reflux, which affects up to 50% of seniors with persistent throat mucus. Introducing additional acid can actively aggravate the primary cause. Please be cautious. Steam inhalation temporarily loosens mucus, no lasting effect on underlying causes. Fine as comfort measure only. Let me bring everything together simply and permanently. That persistent mucus has a reason. 5 possible reasons. Silent reflux happening quietly during sleep with no heartburn. Postnasal drip from invisible chronic sinus inflammation. ACE inhibitor medication side effect developing months after starting a prescription. Chronic mild dehydration running below the threshold that triggers obvious thirst. And gut microbiome disruption sending inflammatory signals your airways are responding to. None of these require accepting a life of constant throat clearing. Each one has a practical, evidence-grounded response. None of the first steps require a prescription or specialist. They require knowledge, consistency, and treating your symptoms as a signal worth responding to, rather than a nuisance to indefinitely manage. If anyone has ever told you this is just getting older, today gave you a different lens. You are not just aging. You are dealing with specific, identifiable, addressable physiology. And you deserve to know that. 3 things in the comments before you leave. Which of the 5 causes surprised you most? Type the number. How long you have been dealing with persistent throat mucus, months or years? And type morning protocol if you are committing to starting all 6 steps tomorrow morning. Share this video with every senior you know who has been quietly carrying water everywhere and clearing their throat dozens of times every day. I am Dr. James Carter. Your throat has been trying to tell you something for a long time. Today, for the first time, you know exactly what it has been saying. I will see you in the next video.